Hello. Welcome to Ask the Vet Live, presented by GoodCharlie Energy. I'm Dr. Mark Stickney, and I am glad you're here today. You know, it is April, and the weather is starting to warm up. So if you are in an area where GoodCharlie Energy can be one of your energy providers, you should check them out. You can find a link to their website here on our page, and they have a number of different plans that may suit your needs. And best of all, every time you pay your bill, they will make a donation to an organization that helps animals, such as Spay Neuter Network. So go ahead and check that out. During the next 30 minutes, we're going to talk about some happenings in the veterinary world, in the animal world. We're going to talk about some things that are going on with Spay Neuter Network. And we are going to go through questions that y'all have submitted. I have had a lot of questions submitted this month to talk about, and then we will also take any questions that y'all send to us live here as time allows. So let's go ahead and get started with things. So it is April, and there are a few things going on in April. April is Heartworm Awareness Month. So you guys have heard me say this many times that every pet in Texas needs to be on monthly heartworm prevention, whether you are a dog or a cat. Your dog should be tested yearly for heartworms, and they should be placed on heartworm prevention and have that be given every month. Heartworms are spread by mosquitoes, and there are no shortage of mosquitoes in Texas. So every time your pet gets bitten, which happens a lot every time that they are outside, that is a chance for them to contract heartworm disease, which is a progressively fatal disease of dogs and of cats if left untreated and not prevented. So we'll talk more about heartworm disease if we have time here during the next half hour, but that is the biggest take-home point I want you to keep in mind from what we talk about today, is that they really need to be on heartworm prevention, and there is a link to our about heartworm disease on our Spay Neuter Network page, and it will list the prices of the heartworm preventatives that we offer, and they are very reasonably priced so that everybody should be able to afford to have your pet on prevention. It is also in April, it is Volunteer Month. We love volunteers at Spay Neuter Network. Volunteers are absolutely essential for us to be able to complete our mission of providing wellness services and ending pet overpopulation by having affordable and accessible spay and neuter procedures for our dogs and cats. I have a few volunteers that come to my clinic here in San Antonio during the week, and they are amazing. They help us so much, and I would dare to say they have a great time doing it. There's a lot of laughing and talking about pets and healthcare and procedures that we do, and I think that they learn a lot about it, and they come away from it feeling really good about what they do and feeling more knowledgeable about what they can tell people and share with people about their pets and optimum pet care. So please go to our website, spayneuternetwork.org. Click on the volunteer link, and we would be more than happy to visit with you and get you set up in some way to help us achieve our mission. Finally, April is also Canine Fitness Month. So yes, dogs and cats, just like us, benefit from a regular exercise routine. And by exercising our dogs and cats, we are also able to trick ourselves into exercise by going to the park with them and throwing the ball around, or going for a walk around the block, or if you've got a really active dog, a little jog around the block before it gets too warm. Dogs benefit greatly from exercise and from doing more than just sitting around the house. A bored dog tends to develop behavioral issues that are not good for them and are certainly not good for us when we see the after effects of those, like chewed up furniture, chewed up shoes, things that dogs will do when they are just bored. So giving them an outlet for some of their energy not only is good for them behaviorally, but it also helps them to stay in good physical shape and not become obese. Dogs that are at a proper lean body weight live 2 to 3 years longer than dogs that are overweight. So it is a little bit of exercise, just like for us. A little bit of exercise for our pets goes a long way toward them having a happy, healthier, and longer life. So keep that in mind here during Canine Fitness Month. I know January and New Year's resolutions are months back now, but it's never too late to start, and anything is better than nothing. So keep that in mind, and now is the time before it gets too hot to kind of get a little routine down for your pets. We have a few things going on in the community. You can get all of these details on our Facebook page and on our website, spayneuternet.org. Tomorrow is free fix for community cats and feral cats at Dallas Animal Services. So tomorrow, Wednesday, April 2nd. Yes, tomorrow is April 2nd, Wednesday. It is free fix for community cats and feral cats at Dallas Animal Services. There will also be similar events in Fort Worth and in Crandall later this month. So check out those dates at spayneuternet.org. It doesn't get any cheaper than free. So if you have a cat that needs to be spayed or neutered, this is a time to do it, and it will not cost you a penny to do it. Speaking of free, we also have free vaccine clinics coming up this month. At our free vaccine clinics, we give free parvo distemper vaccines to dogs and free FVRCP combo vaccines to cats. Other vaccines are available at a low cost, but this is a time to, if you want to get your pets, if you need to get your pets' vaccines updated, which you should do on a yearly basis, going to one of these events will have that happen, and it will, again, not cost you anything. So those are coming up this Saturday in Fort Worth at Sycamore Park. These are all on Saturday. Saturday, April 12th at Warren Sports Complex in Frisco. Saturday, April 19th at Green Pet in Dallas. And Saturday, April 26th at Garland Animal Shelter. So every Saturday this month, different locations this month. Don't worry about remembering those right this second. Just remember to go to our website, spayneuternet.org, and all of that information and those dates will be right there for you. We have had several questions come in through email this month, and I think that is fantastic. And we are going to go through those questions now, and hopefully we will get through all of these here in the next 20 minutes, and also move on to any questions that we that pop up here live while we're talking. But we are let's do the best we can here, and we'll answer these as thoroughly as we can. So, first question is from Nadine, and she writes, I am looking for a definitive answer on whether or not a heartworm positive mama dog can transmit heartworm larvae via blood vessels to puppies in utero. If not, is there any part of the nursing process that can infect the puppies before whelping? Okay, so that is a fantastic question. That is a question that I would often ask my students when I used to teach them. The question is that if I have a dog that is heartworm positive and she is going to have puppies, can those worms be transmitted to the puppies either before they are born or after they are born and they are nursing? So here's the answer to that definitive question. The definitive answer to that question is that I cannot pass live infective adult heartworms to the puppies from the mama dog. In order for a dog to develop an active adult heartworm infection, and that means the live heartworms are growing within the dog's heart and within its pulmonary artery, that has to happen by being bitten from an infected mosquito. The only way a dog can develop live active heartworm disease is by being bitten by an infected mosquito. Now, if I have a dog that has heartworm disease, they have adult worms in their heart, those infected worms, those worms are producing baby heartworms, which are called microfilaria, and those are circulating in her blood all the time. Okay, those are baby immature heartworms. They're not doing anything except being there. Those can pass to the puppies through the placenta and through the milk when the puppies are nursing. That means that the puppies will have immature microscopic immature heartworms in their bloodstream. But those heartworms cannot grow to become adult heartworms in that dog. The only way that that can happen would be for a mosquito to come along, bite the puppy. The mosquito sucks up those baby heartworms, the microfilaria, sucks them up. Once they are inside the mosquito, they are able to mature to the next infected stage, so that when the mosquito bites another dog, now it is injecting infective larvae that will find their way to the dog's heart and grow into adult heartworms. So the puppies are not going to develop heartworm disease that is going to cause them to die from heart failure and a host of other terrible things. They are going to have tiny immature worms that will not cause them any problems, but can be a reservoir for other dogs in the neighborhood to get infected. So your puppies are not going to grow up and in 6 months have adult heartworms living inside of their heart by being born to a mother that had heartworm disease. In order to develop heartworm disease, they have to be bitten by an infected mosquito. So that's a long answer to that question. But what that means is that we always want to have all of our pets on heartworm prevention, and that way, if a mother dog is not going to pass those on to the puppies at all. Okay, I know that was a long answer to that question, but I hope that has answered it. Okay, Alicia asks, since the rabies vaccine is a killed virus, what are the risks of vaccinating pregnant animals against rabies? So if I am using a killed virus, there is a killed virus vaccine, so there is no living viral DNA in that vaccine, there is no risk to the puppies. Now, that being said, it is generally advised not to vaccinate pregnant animals until after they have had those babies, until after they've had those puppies. But and during the first 20 days of the dog being pregnant, that is when I am most likely to develop any sort of genetic abnormalities, malformations, or abortions in that mama dog from a vaccine. So that is most likely to occur if I'm using a modified live vaccine. So if I'm using a killed vaccine, there is really very, very little to no risk of vaccinating if I'm using a killed rabies vaccine. And I will also say, though, that I generally want to avoid vaccinating a pregnant animal and wait to do that vaccination either after they whelp, or ideally I will do it before they become pregnant so that they will have a high level of immunity and they can pass some of that immunity on to their puppies when they are born. All right. Kira asks, my cat seemed very sleepy yesterday and wobbly when she was awake. After she napped a while, she seemed to be back to her normal self. Do you think she's okay? So I will answer this question by saying if happens one time and it's never a problem again, yes, I think she is okay. Everyone's allowed to have a bad day, a day where they don't feel quite themselves every now and then. But if this is a common occurrence, then no, that would not be normal cat behavior, and you would want to have them checked out, have some blood work checked on them, have a neurologic exam performed on them, and make sure that everything seems like it's working okay. Animals that have subtle neurologic disease can be wobbly from time to time. Animals that have liver disease can appear to be wobbly from time to time. And there's a few other things as well. So if it is a one-off, has never happened since, only happened that one time, I think we're okay. If it happens frequently, that pet definitely wants to be evaluated by a veterinarian and have some blood work checked, make sure liver enzymes, blood glucose levels all look normal. Okay, Mike asks, is lung cancer treatable in dogs? So that is a little bit of a loaded question because cancer is always a tricky thing. And when we are looking specifically at dogs, primary lung tumors, which means that this is a cancer that started in the lungs, and because that dog had lung cancer and that's where it is, that is a different thing than a dog that has metastatic cancer that spreads to the lungs. So on the one hand, if I have primary lung cancer, meaning I have a lung tumor, it's in one of my lung lobes, that's where it is, that's one thing. If I have cancer in some other part of my body and it has spread to my lungs, that's a totally different thing. So that's the first thing. That's the first question to ask. Is this a primary lung tumor or is it a metastatic tumor? A primary lung tumor will, once we see that is there, we're going to do some diagnostics to grade it and stage it, which means that we're going to find out how aggressive that particular tumor is. Meaning, is it a pretty quiet tumor? It's just kind of slowly growing there and doesn't have a lot of cellular activity, or is it a very aggressive tumor that is making new cancer cells really, really fast and growing really, really fast? Because that carries a different prognosis as well. The less active the tumor is, the more likely surgical removal is going to be successful. The other thing that we need to do then is stage that tumor to see if it has already spread. Because if it's already spread, then I'm, taking out that lung tumor may not, it will help, but it's not going to cure me because I already have cancer somewhere else in the dog's body as well. So there's lots of things to consider when we talk about that. If I have a low grade, so a not very active, single lesion, single spot in my lungs, lung tumor, then surgical removal of part or all of that specific lung lobe can be curative. And when we say that, we are looking at dogs that will survive anywhere from a period of months up to about 2 years after removal. The thing to think about with cancer is that dogs, in dogs and in cats, is that they don't live decades afterwards like we do. They still have they still have like a maximum lifespan depending on their breed and their overall health of we get out to 15 years. For most dogs, we're doing really, really good. Some dogs live longer, some dogs live shorter, but if we're able to surgically remove a tumor that has not spread at all, then we could consider that curative. And looking at the median survival time of those dogs, they will continue to live for the next 3 years, sometimes up to 2 years post surgery. If it is a more aggressive tumor, or it has already spread, then that survival time drops. And we may be talking about other things that we can do in addition to surgery, such as chemotherapy as well, to try to improve lifespan and survival rate. So that's the answer to that question. It's, I guess, a qualified maybe. It depends on a lot of different factors. Okay, let's see. Amber asks, okay, this is a lengthy but a very good question. I think something that a lot of people run into from time to time. My dog has developed an extreme and compulsive habit of consuming his own feces, displaying a near addictive behavior that's resistant to correction. Despite my best efforts at prompt removal, deterrence, and training, he remains fixated on eating his stool, even going to great lengths to access it. He has even dragged me to get it once. This behavior is accompanied by chronic gastrointestinal issues, including soft, often liquid stools with an extraordinarily potent and nauseating odor, far exceeding the typical unpleasantness associated with canine feces. I like the way the way that's worded, because I thought that was very well described. We've attempted to manage his gastrointestinal health by weaning him onto a grain-free food supplemented with pumpkins, banana, and Greek yogurt, but unfortunately, these changes have not yielded lasting improvements. He was previously treated with worms for worms with a dewormer provided by the shelter, followed by Simparica Trio from our vet. I'd appreciate your insights on whether these issues are interconnected and what additional diagnostic tests or exams you would recommend to address the underlying causes of these problems. Okay, so I had a dog that loved to do this many years ago, and yeah, it's just kind of, it grosses you out, and then they always want to come and lick you or something like that, and it's just like, oh no, don't do that. So I certainly get this. So it sounds like you have done the commonly recommended things: keeping the yard clean, using deterrents. You probably have given them some of the products like Forbid that are supposed to make their poop taste worse than you would think it would, so they don't eat it. You can do some different types of training, like after they go poop, you give them a treat and take them away from it to try to replace that urge with something else. So you've done a great job as far as all that goes. That's fantastic. So here's a couple of things that we should consider and think about. One is that what you're describing here, it's called coprophagia. That's the $50 word for what's going on here. Phagia meaning to eat, copro meaning poop. So coprophagia. One of the reasons, besides behavioral, that dogs will do this is because they have some type of a vitamin deficiency or a gastrointestinal deficiency or issue that can be leading to this. So I would recommend that we have your pet looked at by a veterinarian and have some different lab work done on your pet. I would look at a complete blood count and a complete biochemical panel so that we're going to look at all of our red and white blood cells, make sure that there's no abnormalities there. We're going to be looking at all of our liver enzymes, making sure that our liver function is normal, because a malfunctioning liver will make you do a lot of weird things. We also should test our pancreatic enzymes, especially since you are describing this really, really bad smell that the feces has and an abnormal formation. That can sometimes indicate a problem that is called pancreatic insufficiency, where the pancreas doesn't make enough of the enzymes that it needs to digest the food. And as a result, the pet does not get the nutrients from the food it's eating, and they may start to try to seek that out by eating other things like poop. So we want to test that. So we're going to check pancreatic function. And then I would also do what's called a gastrointestinal panel, which is going to look at different B vitamins in my intestinal tract, and look for any deficiencies there. That it could be another reason why this is happening. So I would look at all of those things, my standard blood work plus my pancreatic function, plus do a GI biochemical panel, specifically looking for any abnormalities there. Now, the other thing that and if we find a deficiency there, we can address that. That may solve everything, or at least get us further along than we are right now. Now, the other thing that kind of caught my eye in what you sent me was that this dog was let's see, previously treated for worms with the dewormer provided by the shelter. So I'm going to take that to mean that he was a shelter dog, and had some sort of an unknown upbringing. And sometimes puppies will become a learned behavior in puppies, where they will eat their own feces. And they do that for stress. They do that because they may feel that there's competition for food, so they're eating whatever's available. And it may be something that the pup learned when it was really tiny and impressionable. And if that's the case, and this is strictly a behavioral issue, then this could be something that has a whole other factor that needs to be addressed, and one that could be a very difficult thing to change. So I would start first by eliminating any sort of a physical biochemical reason for what's going on. Let's start there, and then if we don't find a solution there, we may want to consult with or have our veterinarian consult with an animal behaviorist and see if there's anything else that we can be doing to try to get this behavior to stop. That's an excellent question. Okay, we only have a couple of minutes left. I don't want to rush through these, so let's do one or two more here, and then we will hold these over to next month, and that'll be a chance then for it'll be like a cliffhanger, and you'll come back in a month and we'll answer more of these questions. So let's see here. Hi, Jim says, hi. My dog takes Adequan, and it seems to really help him. However, our new shipment has been delayed, and he is due for his next shot. I have some Adequan that is expired, but I wasn't sure if it's safe for him. I know many oral/human meds are safe, but less effective once expired, but I wasn't sure about an injectable like Adequan. All right, so this is a great question, and so here is my answer for that, is that Adequan is expired either when it says it's expired on the bottle, or 28 days after the first time you punctured the bottle. So if you are still inside of that window of it's only been 2 weeks since you used the bottle, then you're still in good shape, because you've got 28 days from the time you first put a needle in there until it's considered expired. And the reason that it's considered expired at that point is because every time you stick a needle in there, there is the risk of you introducing bacteria into that vial and getting it contaminated. And yeah, you're absolutely right. People, they rightly or wrongly, they take things that are expired, things like that. Milk is still good past its expiration date most of the time. But where I get really concerned about is when it's something I'm going to be injecting into a body, because once that's in there, it's in there, and it is directly in muscles and in blood vessels. And if there's something not right about that injection, I can have some real problems. And it's not easy to get it out once that happens. So I would, if it is expired, I would not put it into my pet. You would if I were you, I would talk with my veterinarian and see if we can. I'm assuming your pet has either some joint issues already, or we're trying to prevent those. So I would talk with him, and if appropriate, start your pet on some non-steroidal anti-inflammatories just long enough to wait to get you to when your next shipment is, so that we prevent any inflammation from building up inside those joints prior to our next Adequan injection. That would be my advice. We are going to do one more question, and then we are going to call it a day. Let's see here. And my next question on the list here is... okay. Amy says, my dog had surgery and they prescribed cephalexin, which is an antibiotic, every 12 hours to avoid infection, I assume, and carprofen for pain every 24 hours. I missed a dose of cephalexin and gave it to her later in the day when I remembered. Is that okay? Yes, it is. So we all have lives, and we all have things that we have to do besides sit with a clock and watch for when it's been exactly 12 hours to give our pets or ourselves our next medication, whatever. So the important thing is that the important thing to remember is that we give, if we forget, we give it as soon as we remember. What we are trying to do with antibiotics, when you have to give them every so many hours, is that you are trying to create a blood level of that antibiotic that is high enough that it will consistently kill whatever the bacteria are that you're trying to eliminate. So if I miss that time, and I've got a certain level of antibiotic in my blood, and then when it's getting ready to give that next dose, it's because my antibiotic level is starting to drop back down below the level where my bacteria are going to start to thrive again. So I give it next dose and I bring that level back up. So if I forget for a few hours, that level's dropped down, those bacteria have started to come back, but my next dose is going to get that back under control. So, as long as we're not talking like skipping 2 or 3 days, we're fine. So when you remember, give it, and everything will be just fine. Okay, that is where we will end things today. I appreciate everybody's questions. I am sorry we did not get to any of the live questions today, but we'll take notes on those, and we will have them to address next time that we talk. In the meantime, I would really like to thank you for joining Spay Neuter Network's Ask the Vet Live in collaboration with GoodCharlie Energy. We are so happy you're here today. Please remember to check out all of the links on our page. Check out spayneuternetwork.org and check out the GoodCharlie Energy link. With GoodCharlie Energy, you are able to access and chat with licensed vets anytime at no cost for free. They also have a discount pharmacy. And please also leave any other questions that you would like us to answer next time, and we will do our best to address them. Thank you all very, very much. It was great to talk with everybody today, and we will see you in a month. Bye-bye.